All right. Hello, everybody. Super excited for this session. We're going to be talking about leadership in times of COVID-19 and beyond. We have the amazing Elie Losleben here with us today. She, as an aid worker raised in Africa and the Middle East, she speaks to leaders about how to design for sustainability and scale positive impact. She's an original contributor to the now industry-recognized digital development principles. Her technology company, Code Innovation, creates software for women's collective empowerment in Africa, South Asia, and Latin America, and has received support from UNICEF, DFID, and the Bill and Melinda Gates Foundation. So thank you for joining us today. Can't wait to hear what you have to say.
Thank you. Thank you, Adam, and welcome everyone. I am really privileged to be here today with you and share what my take is on where we are right now, which, as you know, is changing really quickly. When I talk about leadership in the time of coronavirus, I say leaders, and sometimes that word can be triggering. If you're here, you're a leader. If you want to make a difference in how this goes for all of us, welcome, you're a leader. So before I dive in, I wanted to share a little bit of context. This is Monrovia, Liberia in West Africa. You might have heard of it because of the Ebola epidemic, but before that, a few years after the Civil War, I moved over from New York, where I was working for UNICEF as a digital communications and emergencies person, and I moved over to Monrovia. That was my house in the red building at the very bottom of the bay. It's got a little red bit on the ceiling. And I was working with the Ministry of Education and the Ministry of Health, along with UNICEF. So that peninsula that you see is a very famous Liberian neighborhood called West Point. And during the 2014 Ebola epidemic, the mayor of Monrovia made a very controversial decision, and she quarantined the entire neighborhood. And it was a really scary time for everyone. As you can imagine, families were split apart. People were really afraid. And this is a very under-resourced neighborhood also, as you can see. So they didn't have things that we would have available to us if that happened to us. But there's a happy end to this story because of those public health actions, because of social distancing and other things that they did in a very low resource environment. Public health saved the world. And the Ebola epidemic ended in West Africa, just as it ended in DRC. So this is a really big deal when we talk about what to do next, because public health has a very clear message for leaders, and that is that you can make a difference. And so what I'm going to talk about here are things that we can do, public health actions that require bold leadership right now. We're at a really crucial time, as I don't need to tell you if you're watching this. And so these are 5 actions that I'm going to be going through in depth right now, and then answering some questions, things that you can do to really take action, not just for yourself and your family, but for your wider community to determine how this goes. So let's get started. When I talk about how leaders need to prepare and respond, when I put together this presentation, it was just prepare. So that gives you a sense of where we're at now. To talk about preparation and response is really a question of where you are in the world and how much privilege you have. This is a pandemic. It's a global pandemic. Coronavirus is something that will happen to all of our communities. And where we are right now is in a stage of deciding, okay, if we count as actors, which I hope that I will convince you that you do, how do we do this? And what does it mean to be a leader? First of all, the first thing I can say is it's very uncomfortable. Leadership needs to go first. We need to be the ones being proactive, and often that makes us look rather alarmist. But let me show you just 2 days ago the examples of some of the cognitive dissonance that people are facing, because this is why we don't see people taking action. And as leaders, when we see information and act on it, we need to be communicating and inspiring others to do the same. They're stuck right now in a lot of cognitive dissonance, and a lot of us are too, trying to make sense of this new world, trying to orient ourselves what's going on. I want to show you, if you were on Twitter, maybe you saw this, but a few things that are happening side by side that really don't make logical sense. And when things don't make logical sense, people freeze. These are hospitals in Italy a few days ago. Things are being described as a tsunami, but only the next day in Disney World. This was posted by Abigail Disney in despair, by the way, and these are the crowds that you can see. Now, I promise you, the majority of the people in those crowds have heard of coronavirus. So how is it that they're not taking action? Now, this is why we need leadership. Instead of going into blame and instead of trying to psychologize these people who haven't yet decided how to respond, that's where leadership steps in. Leadership in businesses, leadership in organizations, leadership in our communities and in our networks. So when we talk about how to prepare and respond, what do I mean? Well, as you know well by now, you're going to need supplies to stay home. But a scarier thing to think about is what to do if you get sick or someone in your household gets sick, and what you're going to do to isolate them and what you're going to do to prepare yourself for the supplies that you need, what you need when you get sick. Now, on the resources section of this talk, I link to the CDC's guide for household preparation and also for how to care for yourself if you're sick. So this is absolutely not at all any kind of medical advice, but I'm giving you the perspective of how to find these resources and that we need to have these conversations. We need to be talking about this. So we really do need to be doing proactive things at this point, or now responsive things that are also compassionate. For those of us in charge of policies, now is the time to think about policies that we can have for our people that protect them and that lessen the impact of what this is going to mean, not just the virus, but also the secondary impacts of the pandemic. It is true that these individual actions taken collectively will shift the outcome. That's what population health has shown time and time again. We know that at scale, our actions matter, and these are actions that are being done all over the world right now at scale where there's leadership. The second one is to stay home. And you've probably heard this already, but I can't encourage it enough. You've heard about flattening the curve, canceling everything, staying home. This is a really good time to do that, because the sooner we do that, the sooner we flatten the curve and distribute the cases across a timeline instead of stressing our health systems, the sooner we can all recover and start to strengthen our systems again and start to reassemble and get on with our normal lives. So as we start to do that, we really need to acknowledge that individual actions here and encouraging our communities, our households, our friends, our people on Facebook who may not even know yet that this is serious because they might not be watching the news, all kinds of reasons. We need to help them understand that we're at a crucial time and that kind of social distancing needs to start happening now. You might have seen that people are encouraged to stay 2 meters or about 6 feet away from each other. That's all well and good, but the fact of the matter is that this virus is very asymptomatic, especially in young people. You can have it and not even know you have it. You can be carrying it and you can feel fine. So with that knowledge, leadership needs to understand, with the science of exponentials, the sooner that we slow this thing down, the less the doublings become. So looking at it from that perspective, there's a lot of ways that you can share this message. I've shared it with you with a cup of with a kettle and inviting you to think of this as staying home and having a cup of tea. However, the government in China, as you know, has taken stricter measures, and these are the signs that are up and around China now from a few days ago. If you hang out in public today, grass will grow on your grave tomorrow. It's a very stern, very clear, very stark message. And also today, you go visit friends and relatives. Next year, only the dog is left alive in your house. This might not be the reality where we are right now, but we have to accept, with the cognitive dissonance, that everything still might look like it's fine, that this is not the reality for people around the world. And we need to listen and take the time that we have to be able to adequately navigate. Which brings me to my third point, which is it's very, very important to diet our data or curate our information. There's a tremendous amount of noise in our systems. There's a tremendous amount of fear in our systems. And so it's essential for us as we navigate to understand what we're looking for and to be intentional about what it is that we're taking in. This is not a question of a few weeks. We're going to be navigating this for months, if not years. So we need to understand that and start to regulate ourselves appropriately. And in terms of understanding and navigating how we do that in the deluge of digital information and social media, being very intentional and choosing what kind of media we're reading and receiving and watching, when we're doing it, how we're doing it, how are we taking action on that? Those are all questions that we should explore for ourselves, personal things that we need to set up for ourselves. Because this idea that we start chasing bad news, we can start to plug into the energetic of the stress response we get when we read bad news. And when we start to think what's going to happen, our mind races far ahead of us and can really set fire to the whole situation. And we need to be centered, to be grounded, and to be adult and intentional about what it is that we're reading. And by adult and intentional, I mean that if you find yourself reading news and your shoulders start to creep up to your ears and you start to freak out and you notice your heart is beating and your mouth is dry, take a deep breath and stop. And don't go back to it. And think about what it is you're taking in, and if you want to do that later when you feel better. We need to manage how we feel about where we are. And what I've noticed is that places like Twitter, where they center and really crowdsource excellent primary source information from doctors, from public health officials, can be a good way to orient yourself around the social conversations that are being had by experts. But there's also the WHO and your national health ministry or service and your local health service, as well as the US CDC websites. So all of these places that you can get really actionable data. That's very important because as a leader, I am now telling you, your primary job is to communicate. We need you to amplify the signal. We need that because what's coming is a slow but certain tidal wave that will overwhelm our systems if we are not careful. And we know that weak systems are vulnerable to a lot of interconnected secondary effects. So as we're communicating, we need to make sure that we're amplifying what's useful, what's actionable, what's appropriate for the people that we care about, but also that we're being measured and we have as full of an understanding as we can about what's coming. So this also means for those of us that are leaders in business, in organizations, we're managers of people, of projects, of teams, that we need to communicate compassionately and actionable about how we're going to do our policies. Now, I mean like things like paid sick leave, I mean things like remote work, but I also mean that if you have an organization where you require on-staff presence, that you have a plan for them, for how to take care of them if they get sick. And that's very, very important because there's a lot of essential functions like farming, like making medicine, like pharmacies, groceries, all of our systems that we rely on that while we're in isolation, we're going to need to access. We want people who are attending those jobs well paid and well compensated for the heroes that they are in our system, health workers and everyone else. Now, there's a certain strengths, weakness, opportunities, threat analysis I like to do with social media at a time like this, because how we communicate is so important and it can be very easy to become reactive. I don't need to tell you on social media. So the idea of using the strengths of social media and being very aware of how it can go wrong for you is also essential here, to have that awareness for yourself and for others in your family who might be amplifying their fear and panic in how they're using those platforms in those areas. Another place that I want to talk about, a very essential axis for leadership to amplify and make a difference, is the community response groups. So all of us are often very disconnected from our neighbors. This is a time to know your neighbors, to know who's elderly or immunocompromised or otherwise vulnerable. And another category that's often not included in that needs to be part of the conversation are people living in situations of domestic violence. When everyone is inside, I'm sure you can imagine things becoming amplified or much worse. So there's a support that we need as a community to be able to reach out to our neighbors and to reach out to our friends in a very consistent way, in a way that actually supports systems of care that are going to go on for a while. So in the resources section, there's an amazing area actually in Ireland where they created a guideline for community response groups. Have a look at it. It's a living document, but people have thought out, how do we do this? How do we map the needs? How do we respond so that our long-term capacity is really brought together and strengthened by our collaboration? So I really just want to shout out to all the workers, the grocers, the health workers, the cleaners, all the essential workers that we need to keep our systems going, supporting them and communicating our support to them and our love and care for what they're doing is also essential at this time. So for all of you who are in those roles or who have family and friends in those roles, thank you. Now, the last part that I want to communicate is about self-care. Leadership and self-care are my favorite topics. I could talk about them for a long time, and I do in my longer workshops. So what I'm going to talk about self-care now is really focused on where we are at this point in the pandemic, which is the early days. This is the early days. We need to recognize that. A quick word about stress then, because our stress response is not made to experience a chronic stress. Our stress response is meant to run away from, say, a saber-toothed tiger. You run away for a little while and you stop running. This is not that situation. This goes on day and night for weeks, for months. And if you're tired now, then we all need to learn how to resource ourselves, because I think we all are feeling the fatigue of navigating and making meaning of where we are. The more we do this, the more we care for ourselves together and navigate this together, the better, because if we allow ourselves to isolate, if we don't care about our self-care, we fracture. And that's not good. As leaders, we're counted on a lot. And when we have negative coping strategies, that can be really impactful in a negative way for a lot of people and also for ourselves. So we need to care for ourselves. We need to prioritize ourselves and actually put ourselves first, as selfish as it is, so that we can be able to be caring for others from a place of groundedness, from a place of centeredness. I love to talk about the stress response with cats because everyone around the world gets it. You know that we have a stress response, fight or flight. You've probably heard of those two. Those are the ones on the top. Those are really adaptive stress responses because you're either fighting your stressor and winning or you're running away. And either one, you're out of danger. The more maladapted stress responses that often come from trauma, and again, I can get into this more, but this is a very cursory view, are the freeze stress response. The cognitive dissonance is a freeze stress response where you don't actually know what to do, so you stop. And you don't do anything. That might sound very familiar at this moment, but also the fawn stress response, which is less well known. And that stress response takes people through how we start to give our power away to those in power when we feel helpless, how we will allow power to take control for us. Won't the government save me? Won't someone else save me? Won't you please come and get me? It's almost as if making another power into a parent and becoming a child. On dictatorships, you see this a lot. There's this blind love for the authoritarian figure. It's a fawn stress response. The reason I'm sharing about the stress response is that each of us has a personal way that we like to navigate when we're stressed. There's a pattern that if you're aware of it, you'll be able to track how you follow. And when you know your pattern, you'll be able to sense, oh, I'm fighting, by what your body does. So that's a really fun way to navigate as we learn the stress response, because the stress response can actually become something that helps you center better. You think, oh, I'm frozen. Great. What do I need to do? And there's things that we can do, and I'll take you through one in just a moment. The second thing that needs to be discussed around self-care when we talk about leadership is what happens to us in isolation and the mental health impact of this pandemic. We already had epidemic levels of anxiety and depression 2020 this year. That's the second highest reason people miss work before this virus. It's a massive issue in every country. So the anxiety and depression people are facing now, when they might be indoors with family members or household members who aren't necessarily in healthy patterns with them, imagine that going through the roof and the impacts of that. So the reason I share is it helps to talk about it. It's a taboo subject in a lot of our cultures. I understand that. But the more that we know how to support with social structures of calling people, checking in on people, letting people know that we care, creating relationships in digital ways, these kind of things can really bring people through. I want to move out of the martyrdom archetype that our leaders often have of sacrificing ourselves to the good of everyone else. There is that archetype in a lot of our cultures, but as leaders, we don't have to sacrifice ourselves to our work in order to get the work done. A lot of us decide maybe I won't lead because I don't want to give myself so that I don't have anything left for myself. So I want to encourage you to see other archetypes of being a leader, other stories, because as we cultivate strength and resilience through self-care, that is our ability to see this through. I like to use this model as a compass, a well-being compass for leaders. And so I'm going to close with this and just point out that there's a lot of different types of well-being. Normally, when we talk about self-care, we talk about body. Are you eating right? Are you sleeping? Are you exercising? Maybe we talk about mind. Are you meditating? But we don't really talk about what it means to be mentally healthy or what it means to be connected to people in a relational way. How are my relations with my colleagues? How are my relations with my housemates, with my friends, with my family? The quality of those relationships determines our health. And as we navigate as leaders in our purpose, we all know that we're here for something big. We all know that there's a bigger part of us we haven't explored yet. And what the world is calling for now is for us to become the heroes of our own story. And it's up to us, it's up to you, and it's up to me. And so to close, I wanted to share the 5 public health actions, go through this again with you. We can all do these things. These are all accessible to everyone, preparing and responding as a community, staying home to reduce the spread and the speed at which the virus is spreading. Dieting your information, curating what it is that you take in and being very mindful about that, amplifying your voice in your community and connecting with those that you care about, but fundamentally self-resourcing and resourcing yourself in such a way that you're able to be a leader for others in the weeks and the months and the years ahead. I look forward to your questions. Thank you.
Thank you, Elie. Let me bring your slides down for us. Get us back up on the screen. Such a great message, and one that I think unintentionally went into this week knowing that we're going to have so much good content and I'm going to be in front of a computer all day. I was so intentional about how I start my day and how I'm going to end my day for these exact reasons. So thank you for bringing them together so succinctly. Let me open up.
Oh, Adam, what I would like to do before we start Q&A is lead people through a centering breathing exercise, because I mentioned them, but I didn't actually illustrate them in the moment. So if everyone would allow me to guide you through, it's going to be a 3-breath meditation. And this is something you can do wherever you are. Don't worry, you don't have to close your eyes or anything. We're going to start right now. And I'd ask you to feel your feet on the ground, notice your toes, feel your feet and where they're connected to the earth. And as you breathe in, breathe all the way up into your belly, up into the top of your head. Imagine you can breathe and then exhale and let the breath out. And as you're feeling your feet, you can just take a normal breath in, but let your belly expand. And now feel your heart beating. Feel the air around you. Notice the sounds and breathe normally. And then as you take your next breath in, center yourself again in feeling your feet on the earth. And what we notice, and now just go ahead and breathe normally, what we notice as we bring our awareness to the body, any part of the body, but feet especially, it takes you straight out of a stress response. It's quite interesting. I encourage you to try it. It doesn't even matter where you imagine you're breathing into, how you imagine you're breathing, be creative with it. But what that breathing does, especially the feeling your feet on the ground, is bring you back right into the now. And you can stay present. Nobody has to know you're doing it. But if you give yourself the space of 3 breaths before you react or make a decision, when you're feeling it, I offer that to you as a very accessible and private leadership tool that doesn't require a lot of fanfare or other knowledge.
Yes, I love that. I mean, it's amazing how powerful breath work can be, because it's something that, like you said, you don't have to close your eyes or get your whole body into it. You can just start focusing on your breath, feel your feet. You can do that when you're sitting on your couch looking through Twitter, as you were mentioning. You can do it in a boardroom. You can do it on a Zoom hangout or a crowdcast or whatever. Thank you for that.
Yeah, absolutely.
Let me pull up the questions and see what we've got here. Excuse me. The recurring question I'll just answer real quick is, will this event be filmed and can we see it at a later time? The answer is yes. As soon as I end this, it'll be available for replay almost immediately. You can go back and watch them as many times as you want. Let's see. Oh, lots of people. I think people like your content. They're asking how do they get more of it? So we will make sure to follow up and share out your slides if you're okay with it, and make sure that your video gets
Of course, absolutely. And thank you, everyone. I appreciate that.
Yeah. Trying to see. There's lots of good comments about other stuff. Lots of good comments. People like your. I mean, I'll throw this one out there in case you want to answer it. The top question is, how will this change our future ways of working in terms of our space, technology, process, culture?
Oh, that's huge. I think a lot of us have noticed our ways of working change already. The biggest shift, I think, will be as we're in social distancing, which could take months, or potentially, if we don't do it right, years. We're going to see more and more stay at home, more and more remote. And that will encourage the technologies for telepresence, for VR, AR meetups, and all of the kinds of fun things that have not really accelerated until now. I think we'll see those accelerate. And the quality of our collaboration right now matters so much. And I know a lot of us look for tools to do collective decision making, to do governance when we're not face to face. There is a platform called Lumio that is an amazing democracy and governance platform that helps teams make decisions. Amazing. They're out of New Zealand, and they are just brilliant at creating collaborative work interactions in that way. And so there's software, there's lots of other types of software that are trying to facilitate that too, but moving beyond the chat, moving into more complex ways of relating to each other, more decentralized ways of relating to each other, and of course, more digital ways of relating to each other.
Definitely. That makes me think of something from earlier in your presentation where you're talking about social connection, and how do we strike this balance between isolation to make sure that we don't spread it while also not losing the connection that we have with those around us, because of how important that is. Any tips, thoughts on how we can do that along the way?
I have a lot to say about that. I think that the most important thing as we're trying to isolate is not to actually emotionally isolate. What we're talking about is a physical isolation. And we're already feeling as a society, when you look at our depression and our anxiety rates, very isolated. So this will make it worse, no doubt about it, until, as leaders, we're like, what can I do to make this better? One slide I did take out was that please go on Twitter and watch videos of people singing to each other around the world and feel how your body responds to that expression of solidarity, to that expression of connection. To me, I think that we're going to see the blossoming of the most beautiful technologies of connection, of collaboration the world has ever seen, because by necessity, we're physically isolated. And the hardest thing about this virus is that you can't reach out to touch and care for your parents, for your grandparents, because as for example, me, a younger person, I might be putting them at risk. There's a tremendous grief involved in that needs someplace to go. It's not enough to talk about it. It needs to move. And so however we move that, we're finding ways of doing that around the world that touch my heart. And notice what happens to you when you see those. Notice what it does to you. How do you think differently after seeing something like that? How do you feel? Because there's something emerging now that as leaders, when we pay attention to, we help to bring, and I don't know what it is, but I do think that humanity's response to this has the potential to really see us in a very different world.
Absolutely. Well, with that, would you like to share any other final thoughts with our audience before we wrap up the session?
Thank you. Just thank you for being part of the solution. Thank you for being leaders in this. And I encourage you to communicate with others what it is that you know, with kindness, with compassion, but also with clarity. We're at a critical time. So thank you for doing your part. And I hope that we get to continue the conversation.
I have a feeling we will. Thank you so much for being here, calling in from
you,
New
Adam.
Zealand. It's been great to have you.
And Adam, thank you for hosting this. This is such an important moment to be saying what I'm saying. So thank you.
You got it. See ya.
See ya.
All right. That was just absolutely lovely. We've got one more session to go today. Let me try to answer. It looks like maybe a bunch of questions came in while I was on asking that final question. So I'll do my best to answer a couple of these. From Ed, are we going to upload these videos to YouTube? Yes, we will get them up on YouTube as fast as we possibly can. Bear with us as we try to figure out the best way to do that. Let's see. JP asks, is this the right Facebook group for this conference? Yes, that is the right Facebook group. And I will flash the link here shortly. Let's see. Sandra, thank you for the compliment about the session. Claudia, hopefully we answered your question about resisting being together because it seems so important and possibly some other ways to do it. And yes, Tanya asked about, can we repost a screenshot of the list of 5? Yes, please do. Tag Elie, tag Singularity University. Please spread the word about what she was sharing and talking about because it's so incredibly valuable. And to those of you that I didn't get a chance to answer it, we will follow up with Elie and get her take on as many of these questions as possible, and we'll figure out a way to get those to you. At the very least, we'll be sending some recap emails over the next couple of days with links and content and all that kind of good stuff. So don't worry if you missed it, or you can't find the link, or it's not in the replay. We're going to do our best to capture everything and get it back out to you. And so my final thing on this session, let me just go ahead and share my usual slide for everybody to get those links if you're just joining us. Right here. All right. So like I said, we'll be sharing daily recaps with links. Don't worry about that. All sessions are being recorded. We've got you covered there. If you have any additional questions that maybe we didn't get to, you can also tweet at us on social, and we'll see if our presenters can follow up with you to get those answered. Of course, if you want to join that Facebook group, here's the short link right here for you to get to it. And we are crowdsourcing ideas to some of the biggest challenges that we're facing right now. We'd love for you to contribute and try out the Be Innovative platform, which is a startup that got its beginnings with Singularity University, and we're thrilled to be able to partner with them on those efforts. And of course, if you're trying to figure out what this whole leadership thing means to you, you want to work with Elie, you just want to talk to us about how to get involved and maybe how to build more of this capability inside of yourself, inside of your team, your company, organization, please reach out to us, su.org, or email us at info@su.org. All right, I'm going to wrap this one up. We will see you in a couple minutes talking about how Everlywell and their founder, Julia, went from big idea to make an impact to actually taking the steps to go do that, to the point of being close to release a test or at-home testing, if you will, for coronavirus. So more on that coming up. See you shortly.